So my name is Nurse Mary of Nurse Human, and welcome to my YouTube channel. So today I'm going to be going over 10 tips for new nurses who are just starting out. First of all, congratulations on getting through nursing school, passing NCLEX, and also getting a nursing job. Oh my gosh, you're doing amazing. Congratulations. I am so proud of you and I'm happy for you for getting into the industry. So welcome. I can now call you colleagues. So welcome. So without wasting much of your time, I want to go over 10 tips for new nurses as they start that first job. So you got that acceptance letter. It's saying, hey, we're happy to let you know that you've been accepted to the ER unit, the Med-Surg unit, the ICU, mom and baby, surgical, whatever it is. What are the 10 things that you should remember as you walk in? Let's go over them. Tip number 1, walk in there feeling like you're deserving. It's very easy as a new nurse to feel like you don't deserve to be there yet, like you haven't earned your stripes. You have. You've gone through NCLEX, you've completed nursing school, you're worthy of being on that unit. You were given the job for a reason. So when you walk in there, you walk in there with your head held high. Walk in there like you own the position, like, hey, I've been here already. Confidence says a lot, even for a new person. So when you walk in there knowing that you're deserving. You deserve to be there. You have worked towards being there. So nobody should make you feel bad about being there, regardless that it's your first day. At this time, that's not really your concern. Your concern is that you deserve to be on the unit and you have made your way and you're living your dream. So walk in deserving. My second advice is prepare for the unknown. Why do I say that? Not in a bad way, but you need to prepare your mind for the different possibilities that can happen. And all of this go with the type of people you're going to be working with, the work environment, the workload, the patients. Prepare your mind. You're going to have different kinds of patients. You might be with a preceptor that's not great. You might be with a preceptor who's wonderful. Honestly, there's no way for you to know until you get there. So when you walk in there, keep an open mind, pretty much. Keep an open mind for anything that could happen. But don't let anything that happens discourage you. Let it make you stronger. But I'm saying keep an open mind because I don't want you to walk in there and just be like surprised, like, ooh, I didn't expect this to happen. Expect the things that could happen because you're new. When you have more experience, you're going to know how to deal with those easy. And it's going to come like second nature. Number 3, know that it's not always going to be as hard. When you first start out, you're going to feel like like a preschool kid, like you're drawing within the lines, like you're trying to learn things from scratch. That's just all building foundation. And that shouldn't scare you. That shouldn't deter you. That should only remind you that the foundation you're building is what you need to be able to advance forward. Know that it always won't be easy, but you will eventually get there. Don't think every day is going to be hard. Some days you go to work and it's wonderful. Some other days are just like, oh my God, I'm so drained. But just know every day is going to be different and keep hoping for better days over worse days. Number 4, get the basic things you need before you go for your first day. So what are the basic things? Your scrubs. Those are important. I know there's a whole list out there of everything that you should have, but what I feel are the basic things that you need are like your scrubs, of course. Ask the unit, or it'll be given in orientation what color you guys wear. So get scrubs that are comfortable. You want something that when you bend or when you kneel, well, not kneel because you're not going to be kneeling on the hospital floor, or when you bend over or when you squat, that you're not going to feel like your pants are drawing down and showing or your everything. You also want stuff that's not too tight. Well, it's all personal preference. But at the end of the day, find something that's comfortable. It's okay to also look fashionable. There's nothing wrong with looking good while wearing scrubs. There's people out there now that are making some bomb scrubs that are just wonderful. So do your research, find out something that's not too expensive. There are companies that are selling scrubs that are wonderful priced for each set, and the scrubs are still wonderful. I only wear one brand at the moment and I love them. I love everything about them because even with pregnancy, I'm able to still continue wearing them and feel comfortable. So a stethoscope as well is very important. I will tell you at the beginning, you don't need anything too expensive. I can recommend stethoscopes, but go out there and do some research and see what's available to you. But you need something that hears sounds well. So when we talk about sounds, we're talking about hard sounds, long sounds, vowel sounds, murmurs, which will also be part of hard sounds. So you want to be able to hear those abnormals, because that's when you know to alert the physician or somebody when you start assessing your patients and start being able to recognize those things. A pen light. Not everybody uses a pen light, and it all depends on how you do your physical assessment, but I will tell you, starting out, you should get a pen light. Those are easy to find. They're all over Amazon, or pretty much anywhere you buy your scrubs, they have pen lights. But you will be using those, especially if you're going to be working on a neurology floor. Get ready, because you need to have those pen lights to see pupil reaction and all that jazz. So yeah, you're going to also need a good sheet for report, a report sheet. So something you use to give report and receive report. So it's always good to have one that can help guide you on the important things to ask and the important things to also tell the nurse when you're giving report and going home. So I can also make those copies available to you. Just let me know in the comments below if you do want a copy of a report sheet that a new nurse can use. And good shoes that are comfortable, because you're going to be on your feet all day. So try to find something that you know that works for you. Some people wearing Crocs in the hospital, they have holes in them, so I find them kind of risky, because if there are any spills of blood or anything, that can get on you. But just check, it's all hospital policy and whatever's comfortable for you. But I do recommend closed-toe shoes and those that really have a good grip underneath, because the hospital floors can be very slippery. But at the end of the day, still something that feels comfortable. Comfort is the most important factor. Number 5, jump in when you see learning opportunities. Don't shy away from trying to learn, boo-boo. This is the time. You see another nurse doing a skill that you haven't done before and you're not busy, get in there. Ask them, can I watch you give this IM injection? Can I watch you put in this Foley? Can I assist you? Can I help you with the wound dressing? It's the only way you're going to learn. Because if you're with your preceptor and you don't complete these skills, when your precepting is over, you find that you're lacking in some skills and you haven't really got to observe them. And then you start working on your own and you don't have those skills down. So the best thing to do is shop around. If you're working on a unit with great nurses and you see them doing other skills and you and your preceptor are less busy, ask your preceptor if it's okay for you to go watch. Get in there and watch, because watching will make you learn and learning will make you great, and soon you'll be doing it on your own. Number 6, try to learn the important foundation. This time of preceptorship is a great time to learn foundational stuff. What labs should you be paying attention to? You should know sodium, potassium, things like that. The numbers, what do they mean? Those foundational things that you should already be picking up on. Vital signs, when should you be concerned? Assessments, when should you be worried? A patient comes back from surgery. What are you seeing that concerns you that would make you want to notify your doctor? A patient suddenly starts to have an allergic reaction. Are you noticing that? A patient is going through signs and symptoms of a side effect of a medication. are you able to tell? There are things, depending on the unit you work on, that you will see frequently. So try to get those things down. On the unit I worked on, we would see small bowel obstructions a lot. So I kind of got that down when I started, and I already knew, if they come into the emergency room with a small bowel obstruction, chances are when they get on the floor, there are a few things that could be done. They could order some kind of scan. They could also order for the patient to have an NG tube. They would also order for the patient to be nothing by mouth. They might order for the patient to have medications that help to reduce vomiting, pain medications, so many things. So know those frequent illnesses and how to properly take care of them, especially ones you see frequently. I promise you, you will see some that are not frequent, and those days will come, and you also learn. But if you know something that patients come on your unit regularly with, it's a good idea to learn those foundational things so that you're able to personally make those decisions about when to be worried and when to be calm. I could see a potassium and maybe of 3.4 and say, oh yeah, this is this patient's baseline. I'm not going to notify the doctor. That's my decision based on what I know. But another nurse could see a 3.4 and be like, oh, I really just want to mention it to the doctor just to be on the safe side. That's her decision based on her nursing judgment. But you're going to need to be able to make those decisions for yourself. So you need to learn those foundational things so you're able to start making independent decisions when you start giving patient care by yourself. Number 7, remember to pee and remember to hydrate. I have a jug that I take to work. I got it online, and I'll share it in my next video about the things that I feel like I've loved since I've been doing nursing now since 2015. I take that jug to work and I put it at the hydration station at work. And every so often I will go there and take a sip of water because, girl, I got to take care of myself too. I cannot be at work 12 hours, not drinking water, going home to my baby, looking like a dry, ashy mess just because I'm trying to please patients and the hospital. The only way I can be better for my patients is if I'm better for myself. So yes, hydrate. And hydrating also brings about peeing. So yeah, I see a lot of nurses say, I don't have time to pee. I have to give this patient his meds. You literally have to walk to the bathroom and pee and come right back. And it's difficult, but you have to make that decision and say, you know what? This 1-2 minutes, I'm walking to the bathroom because I gotta pee. My bladder's full. I just gotta empty it. A full bladder will make you cranky. You will yell at your friend at work just because you're like, I don't feel like talking right now. I feel like peeing. Go pee. Stop holding it. Number 8, be helpful to receive help. You will find that with the current patient ratios and the number of nurses working a shift and the patient acuity, sometimes it just gets difficult. When it gets difficult, there is nothing wrong in asking for help. I've been doing nursing for a while now, and I still ask for help, and I have no shame in my game. I will ask the next nurse and say, hey, I need to get this done. Do you have time? But best believe, when the nurse needs help as well, I will be there. I will show up and I will help because I help to receive help. And that is just part of teamwork. I don't think it's anything big. I'm not talking about people who don't do their work and they just keep asking for help the whole time, or you refuse to learn a skill, so then you keep asking people to put IVs for you because you never want to try to stick a patient. That's different. I'm talking about the help that you request when things are just a little bit difficult and you need somebody to help you run a tube down to the lab because you're currently in the patient's room doing a bath, or you're in the patient's room giving a medication. Help to receive help. Number 9, promise yourself to learn something new every shift. That's very important. Don't just go to work every day thinking you know everything, because you don't. I still don't know everything. God, I don't think anybody ever will. Go to work every day and say, you know what, today I'm going to learn what the right range of potassium is and when I should be concerned, what the symptoms look like. I'm going to learn this, learn that. Pick something. It could be something you get from report. Pick something, honey, and just learn something every shift. And then my final number 10, don't be so hard on yourself. You are doing wonderful. You got here, didn't you? You got through nursing school, sleepless nights. You got through nursing exams. Gosh, you got through select all that applies. You got through pharmacology, med surge. You got through research. You're doing wonderful. If you could get through all of that, you can conquer anything. You're on the station now. You're on the unit. It's where you always wanted to be. So don't be hard on yourself. Even on those bad days when your preceptor says, you should know this by now, you don't. Just take it in stride and see it as an opportunity to go learn more. But don't start to whine and be a Debbie Downer on yourself. Tell yourself, oh God, I'm not good enough. Am I ever going to make it? Heck yeah, you are going to make it. You're going to kick butt and you're going to be wonderful. And if you ever meet anyone that tells you otherwise, honey, the only opinion you need is your own. You are going to be great, but you do have to put in the work. But with the hard work, I don't really see any reason why you would not be successful. So yeah, those are pretty much my 10 tips. I hope this helps the new nurse out there. This is my first YouTube video, and I really hope that some people get to see this. I will be uploading videos from time to time, so please let me know in the comments below the type of videos you want to see. And you can follow me on my nursing Instagram page. And you can also follow me through my website as well. I hope to see you in the next video. Give this video a thumbs up if it helped, and let me know improvements that I can make on my next video as well. I'm new to YouTube and I'm really trying to navigate it, but I think the knowledge I have needs to be put out there, and I've been holding back on doing it for a while. So I hope you enjoyed this video. Please share with others and like the video and follow me on my platforms, and I will see you on the next one. Till then, I am Nurse Mary, reporting live from my office space. Bye.